There is a question that millions of adults over the age of 55 never think to ask themselves, and it is a question that could genuinely change the course of their health. That question is simple. Could my blood pressure be climbing right now without me knowing it? It sounds almost too quiet to be dangerous, and that is precisely what makes high blood pressure one of the most underestimated health concerns in the world today. The World Health Organization estimates that more than 1.28 billion adults worldwide live with hypertension, and a striking number of them have no idea. In fact, the WHO has called high blood pressure the silent killer. Not because it is dramatic, but because it is the opposite. It moves through the body without fanfare. It does not always announce itself with chest-clutching moments or sudden collapses. For many people, especially those over the age of 55, blood pressure can rise gradually over months or even years with no obvious symptoms at all. And that is what makes today's conversation so important. Now, before we go any further, let us clear up one of the most widespread misunderstandings about blood pressure. Many people believe that if something were truly wrong, they would feel it. They assume that high blood pressure always comes with pounding headaches, a red face, or a racing heart. And while those things can sometimes occur, the truth is that the majority of people with elevated or high blood pressure feel perfectly fine on most days. The Centers for Disease Control and Prevention, commonly known as the CDC, reports that nearly half of adults in the United States with high blood pressure do not have it under control, and many do not even know their numbers are elevated. That is not because they are careless. It is because the condition is genuinely sneaky. It does not always give clear warnings, and when it does, those warnings are often so subtle that they get brushed aside as normal parts of getting older. And that is the trap we want to help you avoid today. Because while high blood pressure can certainly be silent, it is not always completely invisible. There are, in many cases, early and subtle signs that the body sends when blood pressure begins to creep into unhealthy territory. These signs are not guarantees that your blood pressure is high. They are not diagnostic, but they are signals worth paying attention to, especially after the age of 55, when the body undergoes real physiological changes that make hypertension more likely. According to the American Heart Association, more than 70% of adults over 65 have high blood pressure, and that risk begins rising meaningfully in the mid-50s. So if you are in that age range, or if you care about someone who is, this is worth your time. In today's video, we are going to walk through 8 early warning signs that may be associated with rising blood pressure. Some of these will surprise you. A few of them are commonly mistaken for normal aging, and that is one of the reasons they go unaddressed for so long. We will also talk about what is actually happening inside your body after the age of 55 that makes high blood pressure more common. We will explain the difference between a blood pressure concern that can wait until your next appointment and one that requires immediate medical attention. And we will give you a clear set of steps you can begin today to take a more active role in your cardiovascular health. None of this is meant to replace your doctor. All of it is meant to help you walk into that appointment better informed and more empowered. So if you are ready, let us begin. To understand why blood pressure tends to behave differently after the age of 55, it helps to understand what blood pressure actually measures. When your doctor or nurse takes your blood pressure, they are measuring 2 things. The first number, called the systolic number, reflects the pressure in your arteries when your heart beats and pushes blood forward. The second number, called the diastolic number, reflects the pressure in your arteries between beats when the heart is briefly resting. A reading of 120/80, for example, means that the systolic pressure is 120 millimeters of mercury and the diastolic pressure is 80. For most of your adult life, both of these numbers tend to rise and fall together. But something interesting and important begins to happen as you move past your mid-50s. As you age, the large arteries in your body, particularly the aorta, and the major arteries leading to your brain, kidneys, and limbs, begin to stiffen. This is a natural process. The walls of these arteries contain elastic fibers that allow them to expand and contract with each heartbeat. Over decades of use, those fibers gradually lose their flexibility. Collagen builds up. Calcium can deposit along the walls. The result is that your arteries become less like flexible rubber tubes and more like rigid pipes. When this happens, the heart has to push harder to move the same amount of blood through the system, and that increases the systolic pressure. Meanwhile, the diastolic number may stay the same or even decrease slightly because the stiffened arteries do not recoil as effectively between beats. This pattern is known as isolated systolic hypertension, and it is the most common form of high blood pressure in adults over 55. The Framingham Heart Study, one of the longest-running cardiovascular research projects in history, demonstrated decades ago that systolic blood pressure tends to rise steadily with age, while diastolic pressure often levels off or drops after the age of 60. This means that even if your bottom number looks fine, the top number might be telling a very different story. There is another change that occurs with age that many people are not aware of, and that is increased salt sensitivity. As the kidneys age, they become less efficient at excreting sodium. This means that the same amount of salt that your body handled easily at 35 may now cause your body to retain more fluid, which increases blood volume, which in turn raises blood pressure. Our research published in the journal Hypertension has shown that salt sensitivity increases significantly with age and is particularly pronounced in adults over 55. This does not mean you need to panic about every grain of salt, but it does mean that your body's relationship with sodium may have shifted in ways you have not noticed. On top of arterial stiffening and salt sensitivity, the organs that help regulate blood pressure begin to show subtle signs of wear. The kidneys, which play a central role in controlling fluid balance and blood pressure, may lose some filtering capacity. The baroreceptors, which are tiny sensors in the walls of your blood vessels that detect changes in pressure and help your body adjust, become less responsive with age. Even the hormonal systems that regulate blood pressure, including the renin-angiotensin-aldosterone system, can shift in ways that favor higher readings. All of this means that after 55, your body is simply more vulnerable to blood pressure elevation, even if your lifestyle has not changed dramatically. And this is the context in which we need to discuss the early warning signs, because when these signs appear in a person over 55, they carry a slightly different weight than they might in a younger individual. Let us go through them one at a time, carefully and clearly. The first early warning sign we want to discuss is morning headaches. This is not the kind of headache you get after a poor night of sleep or after staring at a screen for too long. The headache associated with elevated blood pressure tends to occur in the early morning hours, often waking a person up or greeting them as soon as they open their eyes. It is frequently described as a dull, pressing sensation that wraps around both sides of the head or settles at the back of the skull near the base. It may last for an hour or two and then fade on its own, which is one of the reasons people dismiss it. The physiological explanation for this type of headache relates to how blood pressure behaves during sleep. In a healthy cardiovascular system, blood pressure naturally dips during the night and then rises gradually in the early morning as the body prepares for waking activity. Now, this is called the morning surge. When blood pressure is chronically elevated, this surge can be exaggerated leading to increased pressure against the walls of blood vessels in the brain. That pressure can trigger a headache. The World Health Organization has listed early morning headaches as one of the possible signs of high blood pressure, while noting that they are not present in all cases. The reason this sign is so often ignored is that most people attribute morning headaches to stress, poor sleep, or dehydration, and those are valid causes too. But if you are over 55 and you notice that you are waking with headaches more frequently than you used to, particularly if they follow the pattern described here, it is worth mentioning to your healthcare provider at your next visit. The second sign is dizziness, particularly episodes of lightheadedness that come on suddenly when standing up or changing positions. Many adults over 55 experience occasional dizziness, and it is often attributed to getting up too fast or not drinking enough water. While those explanations can certainly be correct, recurrent dizziness can also be a sign that blood pressure is not being regulated properly. When blood pressure is elevated, it can affect the blood flow to the inner ear and the brain, both of which play essential roles in balance and spatial orientation. In some cases, dizziness may also occur as a result of blood pressure fluctuations, meaning the pressure swings between high and normal in an unstable pattern. This kind of variability, sometimes called labile hypertension, has been linked in research to an increased risk of cardiovascular events. A study published in the journal Circulation found that blood pressure variability, independent of average blood pressure levels, was associated with higher stroke risk. The reason dizziness often goes unreported is that it tends to be brief. A moment of unsteadiness, a few seconds of the room feeling off balance, and then it passes. People adjust their behavior. They stand up more slowly, they hold on to furniture, and they move on. But if these episodes are becoming more frequent, they deserve a conversation with a medical professional, not because they confirm high blood pressure, but because they raise a question worth answering. The third sign is blurred vision or visual disturbances. This can include episodes where your vision becomes temporarily blurry, moments where you see small spots or floaters that were not there before, or a general sense that your eyesight seems to fluctuate throughout the day. The eyes are remarkably sensitive to changes in blood pressure because the tiny blood vessels in the retina, the light-sensitive tissue at the back of the eye, are among the most delicate in the body. When blood pressure rises, these small vessels can become strained or even damaged, a condition known as hypertensive retinopathy. In its early stages, hypertensive retinopathy may not cause noticeable vision loss, but it can produce subtle visual changes that come and go. The reason this sign is so frequently overlooked is that many adults over 55 are already experiencing age-related changes in their vision, such as presbyopia or early cataracts, and they assume that any visual change is just another part of that process, and it might be. But an eye exam can often reveal signs of blood pressure-related vascular changes, even before other symptoms become obvious. The American Academy of Ophthalmology has noted that a routine eye exam can sometimes detect signs of systemic conditions like high blood pressure, which is one more reason regular eye care matters as you age. The fourth sign is unusual fatigue, and this is perhaps one of the most easily dismissed signs on the list. We are not talking about the normal tiredness that comes after a long day or a poor night of rest. The fatigue associated with elevated blood pressure tends to feel deeper and less proportional to activity level. You might find yourself feeling drained after a short walk that used to feel effortless. You might notice that you need to rest more frequently during routine tasks. You might feel a heaviness in your body that does not seem to match what you have been doing. The physiological reason for this fatigue is straightforward. When blood pressure is chronically elevated, the heart has to work harder with every beat. Over time, This increased workload can reduce the overall efficiency of circulation, meaning that your muscles and organs may not be receiving oxygen and nutrients as effectively as they should. The result is a persistent sense of tiredness that rest does not fully resolve. The reason so many adults over 55 ignore this sign is that fatigue is incredibly common in this age group for many reasons, including sleep changes, medication side effects, thyroid issues, and simply the natural effects of aging. And all of those explanations are worth exploring. But if your fatigue is new, unexplained, or seems disproportionate to your activity, it is a sign that your body is asking for attention, and checking your blood pressure is one of the simplest places to start. The fifth sign is nosebleeds, specifically nosebleeds that seem to occur without a clear trigger like dry air, nose picking, or a bump to the face. The relationship between high blood pressure and nosebleeds is something that medical professionals have debated for years. Not all research agrees that high blood pressure directly causes nosebleeds, and the American Heart Association has stated that nosebleeds are not a reliable indicator of hypertension on their own. However, some studies have found that people who present to emergency rooms with nosebleeds are more likely to have elevated blood pressure readings at the time, and a study published in the journal JAMA Otolaryngology found a correlation between hypertension and the frequency of epistaxis, the medical term for nosebleeds, in older adults. The likely mechanism is that chronically elevated blood pressure can weaken the walls of the small, fragile blood vessels inside the nose, making them more prone to rupture. The reason nosebleeds are often dismissed is that they are so common and usually resolve quickly on their own. But if you are over 55 and you notice that nosebleeds are happening more often than they used to, or that they are harder to stop, it is worth having your blood pressure checked, not as a diagnosis, but as a reasonable precaution. The sixth sign is shortness of breath during activities that previously felt manageable. This does not necessarily mean gasping for air. It might be as subtle as needing to pause while climbing stairs, feeling slightly winded after walking to the mailbox, or noticing that you breathe more heavily during household chores than you remembered doing a year ago. When blood pressure is elevated over a prolonged period, the heart can begin to change structurally. The left ventricle, which is the chamber responsible for pumping oxygenated blood out to the body, may begin to thicken in response to the increased workload. This is called left ventricular hypertrophy, and it is one of the most common consequences of uncontrolled hypertension. As the heart wall thickens, the chamber becomes less efficient at filling and pumping, which can lead to mild shortness of breath, especially during exertion. A large body of research, including data from the Framingham Heart Study, has confirmed that left ventricular hypertrophy is a significant risk factor for heart failure, arrhythmias, and other cardiovascular events. The reason this sign often goes unrecognized is that adults over 55 tend to gradually reduce their physical activity, which means they may not challenge their cardiovascular system enough to notice the change. They might stop taking the stairs or avoid long walks without consciously connecting that decision to how they feel. If you find that your exercise tolerance has decreased noticeably, this is something to bring up with your doctor. The seventh sign is chest pressure or tightness that does not feel like a classic heart attack, but still feels unusual. This might present as a sensation of heaviness in the center of the chest, a tightness that comes and goes, or a feeling of mild constriction that occurs during physical activity or emotional stress and eases with rest. It is important to be very clear here. Chest pressure can be caused by many things, including acid reflux, musculoskeletal tension, anxiety, and yes, your cardiac issues. Not every episode of chest tightness is a medical emergency. But when blood pressure is chronically elevated, the heart is under sustained strain. The coronary arteries, which supply the heart muscle itself with blood, may be affected by the same process of stiffening and narrowing that affects the rest of the arterial system. This can reduce blood flow to the heart muscle during moments of increased demand, producing a sensation called angina, which is essentially the heart's way of signaling that it is not getting enough oxygen. The reason people often ignore mild chest pressure is that it does not match their mental image of a heart problem. They expect something severe and sudden, and when the sensation is mild and brief, they assume it is nothing. But mild and brief does not always mean harmless. If you experience chest pressure, particularly during activity or stress, and especially if it is a new symptom, please discuss it with your healthcare provider. You do not need to rush to an emergency room for every episode, but you do need to have the conversation. The eighth and final sign we want to discuss is subtle cognitive changes. This is perhaps the most overlooked sign of all, because it overlaps so heavily with the normal cognitive changes that many adults experience as they age. What we are referring to here includes things like finding it slightly harder to concentrate for long periods, experiencing moments of mental fog that seem to come and go, having difficulty recalling words or names that were once easy to retrieve, or feeling that your thinking is just a little slower than it used to be. The connection between high blood pressure and cognitive function has been studied extensively. The SPRINT Mind trial, which was a component of the landmark systolic blood pressure intervention trial, found that intensive blood pressure lowering significantly reduced the risk of mild cognitive impairment in adults over 50. Research published in the journal Neurology has also shown that midlife and late-life hypertension is associated with increased risk of cognitive decline and vascular dementia. The mechanism is related to the effect of elevated blood pressure on the small blood vessels in the brain. Over time, high blood pressure can cause damage to these vessels, reducing blood flow to areas of the brain involved in memory, attention, and executive function. The reason this sign is so frequently ignored is obvious. Everyone forgets things sometimes, and most adults over 55 have been told that some degree of cognitive slowing is perfectly normal. And that is true. But if you notice a pattern of cognitive changes that feels different from your baseline, particularly if it is accompanied by any of the other signs we have discussed today, it is worth bringing the full picture to your doctor's attention. Now that we have discussed these 8 early warning signs, it is important to talk about the moments when elevated blood pressure stops being a gradual concern and becomes something that requires urgent attention. There is a difference between what medical professionals call hypertensive urgency and hypertensive emergency, and understanding that difference could be extremely important for you or someone you care about. Hypertensive urgency refers to a situation where blood pressure is severely elevated, typically above 180/120, but there are no signs of organ damage. A person in hypertensive urgency may feel anxious, may have a headache, or may feel generally unwell, but their organs are still functioning normally. This is a situation that needs medical attention soon, ideally within the same day, but it is not typically a call the ambulance moment. Your doctor may adjust your medication, monitor you closely, or have you come in for follow-up within a few days. Hypertensive emergency, on the other hand, is a different situation entirely. This occurs when blood pressure is severely elevated, and there are signs that organs are being affected. These signs can include severe chest pain, significant shortness of breath, sudden severe headache, unlike any you have had before, visual changes that do not resolve, confusion or difficulty speaking, weakness or numbness on one side of the body, or signs of a stroke. The American Heart Association uses the acronym FAST to help people recognize stroke warning signs, face drooping, arm weakness, speech difficulty, and time to call emergency services. If you or someone near you experiences any combination of these symptoms, along with known or suspected high blood pressure. This is a medical emergency and requires an immediate call to emergency services. It is not a time to wait and see. It is not a time to drive yourself to the hospital. It is a time to call for help and let trained professionals take over. We say this not to frighten you, but to inform you, because the difference between a good outcome and a poor one in a hypertensive emergency often comes down to how quickly treatment begins. It is also worth mentioning that a single high blood pressure reading does not necessarily mean you are in crisis. Blood pressure fluctuates throughout the day in response to stress, activity, caffeine, hydration, and many other factors. A single elevated reading at a pharmacy machine or even in a doctor's office does not define your overall cardiovascular health. What matters most is the pattern over time. That said, if you ever see a reading above 180/120, do not ignore it. Contact your healthcare provider for guidance, even if you feel fine. So with all of this information in mind, let us turn to what you can actually do, starting today, to take a more active role in understanding and managing your blood pressure. The first and perhaps most empowering step is to begin monitoring your blood pressure at home. Home blood pressure monitors are widely available, relatively affordable, and endorsed by the American Heart Association as a valuable tool for managing hypertension. When used correctly, so they can give you a clearer picture of your blood pressure patterns than occasional readings at a doctor's office, which can be affected by white coat syndrome, a well-documented phenomenon where the stress of being in a medical setting temporarily elevates your blood pressure. When using a home monitor, there are a few important techniques to follow to ensure accuracy. Sit in a chair with your back supported and your feet flat on the floor. Rest your arm on a flat surface so that the cuff is at the level of your heart. Avoid caffeine, exercise, and smoking for at least 30 minutes before measuring. Sit quietly for 5 minutes before taking a reading. Take 2 or 3 readings, spaced about a minute apart, and record all of them. Do this at the same time each day, ideally once in the morning and once in the evening, and bring your log to your next medical appointment. This kind of data is incredibly useful for your healthcare provider and can help them make more informed decisions about your care. Beyond monitoring, there are meaningful lifestyle adjustments that can support healthier blood pressure. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is one of the most well-studied dietary patterns for blood pressure management. It emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while reducing saturated fat and added sugars. Clinical trials have shown that the DASH diet can lower systolic blood pressure by as much as 11 millimeters of mercury in people with hypertension, which is comparable to the effect of some medications. Combined with sodium reduction, keeping daily intake below 2,300 milligrams, and ideally closer to 1,500 milligrams for adults over 55, the effects can be even more pronounced. Given the increased salt sensitivity that comes with age, as we discussed earlier, this is particularly relevant for this audience. Physical movement is another powerful tool. You do not need to run marathons or lift heavy weights. The American Heart Association recommends at least 150 minutes per week of moderate intensity aerobic activity, which can be as simple as brisk walking, cycling, or swimming. Consistency matters more than intensity. Even short daily walks have been shown in research to lower resting blood pressure over time. If you have mobility limitations, chair exercises, resistance bands, or water-based activities can also be effective. The goal is to keep the cardiovascular system engaged in a sustainable way. Stress management and sleep quality are 2 often underappreciated factors in blood pressure regulation. Chronic stress activates the sympathetic nervous system, which raises heart rate and constricts blood vessels, both of which drive up blood pressure. Sleep disorders, particularly obstructive sleep apnea, are strongly associated with hypertension and are more common in adults over 55. If you snore heavily, wake up gasping, or feel unrested despite adequate sleep time, it may be worth discussing a sleep study with your doctor. Simple stress reduction practices such as deep breathing, gentle stretching, spending time in nature, or engaging in hobbies you enjoy can contribute to a calmer cardiovascular baseline. And of course, regular checkups remain essential. Even if you feel well, having your blood pressure checked at least once a year, and, more frequently, if you have risk factors, is one of the most straightforward ways to catch changes early. The SPRINT trial, one of the most influential blood pressure studies in recent decades, demonstrated that lowering systolic blood pressure to below 120 in high-risk adults significantly reduced the risk of heart attack, stroke, heart failure, and death from cardiovascular causes compared to a target of below 140. This trial reshaped guidelines and underscored the importance of not just treating high blood pressure, but treating it effectively and to appropriate targets. Talk to your doctor about what target is right for you, because it may depend on your individual health profile, medications, and other conditions. As we bring today's conversation to a close, we want to leave you with a sense of clarity and confidence, not worry. High blood pressure is common, especially after the age of 55, but it is also one of the most manageable cardiovascular risk factors when it is identified and addressed. The signs we discussed today, from morning headaches and dizziness to subtle cognitive changes, are not meant to serve as a self-diagnosis checklist. They are meant to help you pay closer attention to what your body might be telling you, and to give you the language and the context to have a more meaningful conversation with your healthcare provider. Knowledge is not about fear. It is about preparation. And by watching this video, you have taken a step that many people never take. If you found this information helpful, we would truly appreciate it if you subscribed to the Vital Age Clinic and turned on notifications so you do not miss future videos. We publish new content regularly, all focused on helping adults over 55 navigate their health with trustworthy, evidence-based information. In our next video, we will be exploring how common medications can sometimes affect blood pressure in ways that many people, and even some healthcare providers, do not always consider. It is a topic we think you will find both surprising and practical. Until then, take care of yourselves, stay curious about your health, and remember that the most important thing you can do today is simply pay attention. We will see you in the next one.